burning when you pee, constant itching down there. Is it urinary tract infection or a yeast infection? Here's the scary part. Many women confuse the two and end up treating the wrong thing. But in the next few minutes, you will learn the difference clearly, quickly, and for good. Please do not hesitate to subscribe to the channel, like, and share this video. Urinary tract infections and yeast infections are two of the most common reasons why women feel pain and discomfort down there. But they are not the same. They affect different parts of the body and have completely different causes and therefore require different treatments. Let's break it all down so that you can spot the signs and act fast. What is a urinary tract infection? A urinary tract infection, or a UTI, is caused by bacteria, usually E. coli. It affects the urinary system, which includes the bladder, the urethra, and sometimes including the kidneys. It happens when bacteria from the vagina or the rectum enters into the urethra and starts multiplying. But what if the issue isn't bacterial at all? That is where the yeast infection comes in. A yeast infection isn't caused by bacteria. Instead, it is caused by the overgrowth of a fungus called Candida. It mainly affects the vagina, leading to irritation, itching, and discharge. And unlike UTIs, antibiotics won't fix this. They can actually make it worse. So now you know, one is bacterial and one is fungal. But why do they get mixed up so often? Well, that is because they share a few key symptoms. Both can cause irritation and burning sensation, especially during urination. They both affect the female reproductive system and both can disrupt your daily life, as well as causing discomfort in the same region. But their differences are clear once you know exactly what to look for. Now let's look at the unique symptoms of the urinary tract infections versus that of a yeast infection. The symptoms of a urinary tract infection includes pain or burning just when you are urinating, usually when you are about to round up urination. Cloudy, dark, or foul-smelling urine. Constant urge to pee, even when you just did. Frequent urination, as well as mild stomach pain. Now for the yeast infection, there is intense itching around the vagina, presence of a thick, white, clumpy discharge, usually similar to that of cottage cheese. Redness and swelling of the vulva, that is the external genitals. Pain during sex or urination. The discharge alone can be a big clue. Here's how to tell by looking at that. With UTIs, discharge is usually absent. If there is anything unusual, it is definitely the urine, as it is cloudy, smelly, or sometimes tinged with blood. Yeast infections, on the other hand, comes with thick, odorless, white discharge that is completely hard to miss. I know you might be wondering, what triggers each of these conditions? Let's talk about the causes. For urinary tract infections, the cause could be wiping from front to back, holding in urine, sexual activity, and menopausal or hormonal shift. And for yeast infection, The causes could be as a result of intake of antibiotics, wearing tight, non-breathable undergarments, uncontrolled blood sugar, like in diabetes, as well as having a weakened immune system. Okay, now that you know what they are, how they feel, and what causes them, how do you treat them safely? For UTIs, antibiotics are usually required, but do not self-treat. See a doctor, because if left untreated, it could actually spread to your kidneys. For yeast infections, on the other hand, antifungal creams, suppositories, or tablets work a great deal, of which many are available as over-the-counter medications. But do not guess. Get a diagnosis first from the doctor. So, when should you stop Googling and start seeing a doctor? If your symptoms persist beyond a few days, or you are not sure what you have, you should definitely see a doctor. It's better to be safe than sorry. Now let's have a quick recap. UTIs are bacterial, they affect the bladder, and they require antibiotics. While yeast infections are fungal, they affect the vagina and require antifungal treatment. Knowing the difference helps you to treat it fast and prevents it from getting worse. Now you know how to tell the difference between a UTI and yeast infection. If this video was helpful, please do not keep it to yourself. Remember to like, share, and subscribe for more honest women health tips, because your body deserves answers.